And welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwartz, licensed midwife and one of the MCs here at Gold. And here at Gold, we're very busy and getting ready for our Gold Tongue Tie Symposium 2025. And with me here today is Dr. Zinal Shah. Hi, Zinal. It's good to have you here at
Hello.
Gold.
Hi, Christine. How are you?
Good, it's good to have you here. You have a wonderful presentation planned for us, and the title is Long-Term Consequences for Untreated Tongue Tie, the Role of the Fascial System. Before we go into the presentation itself and talk about that, tell me a little bit about yourself. You are in India, is that correct? And tell me about
That's
your
right.
professional background.
Yes. Yeah, so I am a pediatrician. I was very passionate about being a doctor, and I'm a university topper. And while I was doing my pediatric practice, I realized that there is not enough lactation support available, and breastfeeding became my passion. It became my calling, and that is how I call myself a breastfeeding advocate. During the practice of breastfeeding, there were some things which probably I realized I don't know by learning from people, attending conferences, and it was so crazy that I realized after so many years of practice that that the facial system can really impact a lot of symptoms into adulthood, symptoms into bigger children, symptoms into humans, and where little tightness can actually affect so many multiple systems.
That is absolutely fascinating. I know we are learning nowadays we hear a little bit more about the fascial system, and I know a few years ago nobody was talking about it, but now we have some research about it, and we're still learning, right? I feel like, and so now maybe it's just me, but I feel like we're just kind of touching the tip of the iceberg. I feel like there's still so much more to discover about this amazing system, right? And
Yes.
and talk to me a little bit about tongue tie and the fascial system. What is important to consider there briefly?
Okay. So what happens is it's like the fascial system is something which is like a cling film. It's like a very tiny cling connective tissue which covers the entire human muscles. So we are not 690 muscles separate, but we are one system. So if we are tight in one place, it can cause tightness somewhere else. And that is
Mm.
where if there is a frenulum which is short, which is thick, which is pulling the fascia and pulling, of course, the genioglossus muscle, that fascia is going to cause tightness in the diaphragm, it's going to cause tightness in the pelvis, the hip muscles, and the child will have multiple symptoms. It also causes tightness in the muscles of the shoulders, with drooping shoulders, the hamstrings. So it's very fascinating to understand that one tiny thing being pulled at one place, which is their tongue tie, can actually cause tightness in the other parts of the body.
So let me ask you this. Let's say there is tongue tie and there's this tightness, right?
Yes.
What kind of where could we be seeing that? Would it be like in the face and the posture? Give me some examples here. What we
So
could be
like if it
seeing.
is, yeah, so what we can see if we talk of babies, then in babies, because of the tightness of the frenulum, which it restricts the mobility of the tongue and the jaw growth, it also causes muscle tightness of the neck with torticollis, and there is a
Mm.
change of the head shape with plagiocephaly or maybe oligocephaly, or the child might just continuously look like that. Like I have children who look like that up, and I'm like, they're not looking at you. The baby does not even look at the parents. The baby is looking like that. And then you start thinking that why is this baby not aligning to the center? So because the fascia is very tight, it does not allow the baby's body to align to the center. And because it also causes tightness in the diaphragm and the chest muscles, these babies can have symptoms like vomiting, reflux, lot of aerophagia. So these are the multiple symptoms which we see in babies when there is a tight frenulum.
Hmm. So besides the obvious, it depends on, of course, the case. We can't see this, of course, about all cases. We have to obviously look at each case. Besides doing a frenectomy, what else can be done? I mean, cutting sounds to me like, yeah, we're making a cut, that makes a change also in the fascia, of course, right? But what else can we do to help this little one?
So to be very honest with you, there has been so much of controversy with regards to the cutting. So in my talk, I'm not talking about cutting at all. So
Okay.
what we are talking about is that how you take care of the facial system. That means when we take away the tightness, okay,
Mm-hmm.
the symptoms reduce. So it's like if I have a back pain, I will kind of go and take help, that get some massage or maybe do some icing, or that is how normally we work on. So fascia tightness can be done with other kind of therapies, which could
Right.
be craniosacral therapy, osteopathies, massage. Some children do, doctors also do cryo practitioner therapies. You can do needling therapies. You can do myofascial release. You can do absolutely working on the muscles. Like most important, according to me, which I have seen in my practice, is exercises. Like I teach my patients a lot of exercises. I don't
Mm.
even talk about phenectomy, and just by doing a good amount of exercising where we help in the functioning of the tongue. So we help in extension of the tongue, elevation of the tongue, lateralization of the tongue, which actually makes the functioning better and the symptoms also reduce.
Absolutely fascinating. And I can't wait to see some examples there that you will give us during your presentation, correct?
Yes, I will
Wonderful,
do.
wonderful. And of course, as we know, since this is a gold presentation, everything is you're presenting, this is research-based, evidence-based, right?
Yes.
Absolutely wonderful. Yes. You know what? Another thought I had talking about fascia, one thing I can imagine is that babies or people, if it's an undiagnosed or late diagnosed tongue tie, obviously it could affect speech, right? It could affect, has an effect, of course, of breastfeeding, number one. And I can think of that babies are very smart, right? Babies are very smart, and they come up with maybe ways to compensate. So how do we then, is that also part of the exercise that we kind of they relearn to not compensate in a certain manner, maybe because when they had the head always like this and they learned how to kind of, to compensate and do a little something there. How do you work with when you see any compensation going on?
So to be very honest with you, a lot of times these symptoms are masked by the compensations. So the
Ah,
compensations, the human body always wants to come back to normalcy. So the human
mm-hmm,
body is designed in such a way that it will fight back to get normal. So being a state of normal is something what the baby's body or an adult's body wants. Now in that process, a lot of times we doctors miss, or we even lactation professionals, we miss because the symptoms are masked by the compensations. So now
mm,
coming to the fact that how do you identify? So that is what I'm going to discuss age by age in the presentation. You know that in babies, what compensations are you going to see? In toddlers, what compensations are you going to see? In adults, what compensations are going to be we are going to see? So and then understanding these compensations, how do we deal with it is going to be very individual. Like
mm,
okay, does this child require speech therapy? Like a lot of times these toddlers and little bigger babies also have gut issues. They are fussy eaters. They have digestion issues. So how do you deal with it? So then step by step we have to correct, of course, the individual issues and the root cause. So most of the times only the symptomatic treatment is happening, but the identification of the root cause is not happening, which is the fascia tightness maybe. So here we are going to try to analyze the root cause as to why the symptoms are coming in first place.
wonderful. That's very interesting. Yeah. So really seeing it's, masked because of compensation. Maybe that's why it's being untreated. Can you think of something that was most surprising to you, when you saw something, maybe a consequence of a masking or compensation that we might not be aware of? Maybe something unusual you
Yeah.
saw in your practice.
So I saw a penguin gait. Okay, that means walking, not able to run and walking like a penguin. So
Interesting.
I thought that this kind of a gait is just there because maybe this child has never learned how to walk right. But then actually when you see that why is the child walking like a penguin? And people used to kind of mock her and tease her in her classes, and she could not take part in any sports activities as a kid. And then we realized that it is because of the tightness of the hamstring muscle, because of the tongue tie, that this girl couldn't walk.
Wow, wow. I mean, that was, and I'm sure that was completely gone, unnoticed for that many years because
Yes,
people were not thinking to connect this to a tongue tie, right? I
yes,
mean, wow,
yes.
that is
And
amazing.
this is my daughter Christine. So you can imagine that it's my own daughter,
Oh
and I
goodness.
did not pick it
Yes.
up for like so many years.
Yes, and but the good thing is that she is your daughter, and you were able to do this, right? Just
Yes,
imagine if she was not, if you weren't there, it might have ever been diagnosed, and nobody would be
yes.
ever able to help her. And I know I've seen a picture of your beautiful daughter. She is now
Thank you.
able to fully.
Yeah, she's a doctor too now.
No, wonderful. See that, wonderful. So, well, thank you for sharing that. And I know you're going to talk about that more in the presentation as well. So I can't wait to learn from you, Dr. Zanal. Um,
Great.
it's before I let you go here, I wanted to ask you, what are your biggest hopes that our viewers will take away from this presentation?
So I feel, being in lactation professionals, we all should keep our eyes open to what can happen if we miss the bus, if we miss the plane. So then
Yeah.
just see what tightness is going to lead to what symptoms, nobody can figure out at that particular point. But we should be aware of the fact that, by missing it and by not identifying it, we are maybe letting this child go into further damage, future damage, which can impact this child's growth and development and future in a big way. So that is my
Hmm.
most important message, that, please keep our eyes open to what can happen if we miss it.
Oh. Well, thank you so much. And I know this presentation of yours will be wonderful and really guide us along the way. So we hopefully are more prepared to and not miss anything along the way. Thank
Yes.
you so very
Thank
much, Dr.
you.
Zinal.
I'm excited too. Thank you.
And now I have some information for our viewers. This presentation, Long-Term Consequences of an Untreated Tongue Tie, the Role of the Fascial System, is part, as I mentioned, of our Gold Tongue Tie Symposium 2025. We get started, it's just right around the corner with our opening keynote presentation by Dr. Agarwal. This is free and open access, available to everyone. So if you would like to find out more about Dr. Zinal's presentation, the keynote presentation, and the entire Tongue Tie Symposium, we invite you to go to goldtonguetie.com for more information. And I hope to see everyone at the symposium. Thank you so much for watching. Have a lovely rest of your day, everyone. Bye-bye.
Bye bye. Thank you.